So next up, following on from that conversation around business, industry and jobs, we've got a panel that's going to be moderated by the wonderful Billie Sankovic, the Chair of South Western Sydney Local Health District. On the panel will be Simone Proft, the CEO of Ingham Institute, Chloe Reid, Managing Director of TAFE New South Wales, and Professor Zoe Terpening, Pro Vice Chancellor of Precincts at University of New South Wales, Sydney. Please welcome to the stage.
Well, the panel's coming up. It's great to be here, and it's an incredibly exciting and important time for South West Sydney with the significant levels of investment we've seen, not just from the public sector, but from the private sector as well, and indeed in sort of collaboration. And I think the last panel discussion really set the scene for our discussion here today, and I think they posed a few questions for us as well. But can I just say that housing and infrastructure is an absolute fundamental, as we all know. But if we want to build health and well-being, those other fundamentals are just so important. You know, health, education, employment, and access to services. And that's, I think, critically important in the context of historical growth and inequities in access that are experienced by people that live in southwestern Sydney. So I guess it's within that context we really want to move beyond housing and infrastructure and do a bit of a deep dive in those spaces. So what we'll be doing is asking some questions around, you know, how do we turn our minds to progressing and unlocking some of the local talent and the local opportunities and the local skills? How do we build and expand on the innovations we see in the Southwest, and how do we build on those collaborations? So Simone, I'm going to start with you, and please just a reminder that we really want this to be an interactive session, so we encourage you to put up your questions, including for health. So it's not just questions for our panel, but I'm certainly happy to address some of those. Who was it, Kate? You already posed one about Campbelltown that I'll hopefully get to. But Simone, I might start with you in terms of Ingham's and the extraordinary work that you're doing in terms of progressing you know, robotic surgery and automation in health, and of course the really exciting news about the soon-to-be launched Campbelltown Health and Education Precinct. So can you tell us a little bit more about that in terms of attracting the workforce we need, and also what opportunities that might provide into the future?
Thanks, Billie. So the Ingham Institute for Applied Medical Research is the medical research institute for southwestern Sydney. Our population is your population, and our focus is improving the health outcomes of our population. But as my chair always says, it's also about attracting workforce. And I think, so as Billie said, and thanks so much, Billie, so nice to be here today. We are really developing and growing as we need to in the Southwest. So the Ingham Institute was first conceived in Liverpool in 2008 with our building in 2012, and since then has really grown. And one of our fundamental reasons for being is to attract workforce, because if we are delivering cutting-edge care in southwestern Sydney, then we are going to attract the doctors, the nurses, the allied health professionals into the future. And that's a really, really important aspect of it. And so, because they want to train on the latest care. And I've got to say, there's a lot of aspects around southwestern Sydney where we are the best. And I think we really need to reflect on that and think, you know, our professor of research, his daughter had her baby at Liverpool Hospital the other day. Our hospitals are excellent, our care is excellent, and our medical research institutes are excellent because we're delivering that cutting edge care. Equity has to be a huge part of everything that we do. We know that out of our 1.2 million population, 500,000 people are in the lowest quintile of socioeconomic disadvantage. So we have a lot of wealthy people, but we also have a lot of people who struggle. So for that reason, so much of our research is about those people, is about our population and uplifting that population. But we need to do more in this area because we have got such a big population to do that. And I think for us, we need to lean in to our strengths. So our new institute that's opening in Campbelltown Hospital, Ingham Institute MacArthur, is going to lean into 3 aspects of that. It's going to have a real focus on our kids, because we've heard about the birth rate today. It's going to have a real focus on diabetes and obesity, because we know that our community struggles with those diseases. But then it's also going to take where we're the best. I mean, did you know that we have some cardiologists at Campbelltown Hospital who are doing amazing world-leading AI work? Bet you didn't. But there's a lot of that going. So harnessing our strengths is what we're doing, because we know that will grow our workforce into the future.
Yes, absolutely. And I think some of the important points that you made there, Simone, is, and I think the previous panel also referred to that, was about complexity of care. And that comes at a higher unit cost. You know, so that's certainly something that we are acutely aware of. But there are just these incredible opportunities, and we are centres of excellence across a number of our disciplines in this region that we really need to build on. So thank you for that. Chloe, I might turn to you. Specifically, I guess jumping into industry. So we have our dominant industries, you know, the care economy, construction, education, and manufacturing as well. We talk about that as advanced manufacturing, but manufacturing is still quite strong, particularly in those industrial corridors around Campbelltown and Fairfield. And another interesting one that we don't talk about in terms of our dominant industries is retail, which is, one of our highest employers in the area. And then we have our emerging industries, advanced manufacturing, or the impacts and changes as a result of technology. And then we have our expanding industries, which we know is health and education and part of the care economy. So within that context, what's TAFE thinking in terms of, aligning with those demands in skills and knowledge into the future?
Yeah, that's a great question. Thank you. I think there's a few things there. One is that, as you name those industries, TAFE is kind of the bread and butter of a lot of the workforce in those industries. And so I'm really glad that I'm on the same panel here as Zoe, because I think we have to think more carefully about the full range of workforce and think a lot about the way that we are presenting pathways, both to young people coming out of school, but also people who might wish to retrain to access those sorts of industries. The second thing that we're doing is that TAFE has recently, this is just such a government comment, so I'm sorry, we've just reorganised ourselves, but we're in faculties now. And from the point of view of someone who's worked for her whole career in education, that makes a lot of sense to me, but it also makes a lot of sense to industry, because the point of a faculty is what I would call kind of subject excellence, but actually it's industry excellence for TAFE. So it's about really understanding, what does advanced manufacturing look like? What role does AI and robotics play in that? And how can we really work very closely, particularly with university partners, but also with schools, so that kids understand those pathways? And then the third thing is some very specific investment in particular industries. And so thinking about the Advanced Manufacturing Centre of Excellence at Wetherell Park, that's part of a sort of Commonwealth and state jointly funded initiative. And the idea of those centres of excellence is that they're kind of a hub and spoke model. So you develop the expertise and the excellence there, but it's not limited to that particular place for delivery. So I think we're really interested in connecting differently with industries. But I would also say, given we're at the South West Sydney Development Forum, we have to think more carefully about place. And so for us to be clear about, I think the local member mentioned 11 new government preschools in this area. We have to be thinking about early childhood education proactively in this area, so they have the staff to deliver in those growing and expanding industries. So lots to do, but I feel like TAFE's well positioned and better positioned than it has been in the past to take up the challenge.
And it's an incredibly exciting time with, I guess, trying to think of the right word, I think the rebirth of TAFE.
Yeah.
Right? After several decades of, a significantly competitive marketplace that hasn't necessarily been able to respond to industry demands and the context of what's going on, not only in southwestern Sydney, but more broadly across the state. And you talk about sort of those the models you're moving forward with in terms of place. So Zoe, I want to actually come to you about that, because I know that you're doing some pretty interesting, innovative place-based work. And I'm a particular advocate of, a universal, local, universal baseline level of service, because we know that when people are experiencing vulnerability or crisis, this is where they turn to. So we need to be thinking about baseline and place-based. So can you tell us a little bit more about the work that you're doing in the context of the growing population and the need for skills and growing skills and knowledge?
Thanks.
And tapping into local talent, which we're going to talk about in a minute.
Thanks, Billie, and I think I can cross over many organisations with my response too. I reflect not just the interests of my own university, but those many other universities in the region with whom I work very closely, and also TAFE. So I think historically we had, this kind of perception that, that innovation could be brought into regions. And I've always been a really strong believer, and particularly with the kind of focus on productivity at the moment, that place-based innovation is actually a really important mechanism for unlocking that productivity. And some of the best work that we've done in recent years has been to look at those kind of local community needs and to unlock through place-based partnerships what those community needs are and how we respond to them. And I know for many councils in the room, and some that are not represented here today within Southwest, the best partnerships that we have are when community or in this case a council has articulated to us that they have a particular need that they need to solve for their community. Sometimes that's been around sustainability. We've got quite a few examples for UNSW in that space. And they've said to us, we actually need a solution for this for our community, but you've got to give us a solution that we can drive, so that we can implement, that we can own. And so this idea that innovation would be brought into a community like Southwest Sydney, I think is so outdated. I think we actually have the talent and the innovation within the networks here, and we need to enable the partnerships that allow that to flourish and grow. And I often say this is future Sydney for me. I grew up in this region, which surprises many people given the university I work for. And I genuinely believe that most of the solutions for all the challenges that we're talking about here are going to require innovation, and we see it in droves, and I'm sure we'll come back to that. One of the things that I think we've been doing with TAFE quite nicely is if you look at some of the statistics for higher education participation in this region, it can hover in the high 30s for organisations like universities, and you compare that to other areas in Sydney that are, inner Sydney, for instance, at 55%. So there's a critical need to ensure that people have they've definitely got the aspiration, but have the right information and the right supports that we can break down the barriers to increase that participation. And we've got in an area in Southwest Sydney, we've got 3 levels of government working together to deliver suburban study hubs. So this idea that we can increase participation in this region, and very kindly a new partnership with TAFE, embedding that in TAFE so it is genuinely university agnostic. And so those partners will work together to deliver that. And it's all about how do we unlock that talent locally so that they can live, work and play in the regions, and also build the future that we need for this city.
Yeah, absolutely. So that's a great segue. And you asked that question yourself, and I'm going to put it back at you. So we do have extraordinary local talent. And, you know, it still boggles my mind that people would say to you, oh, you grew up in Western Sydney, right? So did I. I actually live in the Macarthur MacPac. I'm watching, where are you? And you know, there still is this sort of sense or stereotype around that. So we do have extraordinary local talent. We have a spirit of entrepreneurship that is leading in this country, and we can see that through our small businesses and social enterprises as well. How do we then tap into that in your areas, and how do we facilitate and unlock that, and then align that with you know, our industry growth and demand and need? And when you're, and I'm going to ask each of you, I want to hear all of your ideas, but I also want you to also, within that context, think about, you know, that saying of we have the most qualified taxi drivers in this country. So we still have this, this problem with recognition of overseas qualifications. So if you can just sort of factor that into your thoughts. Maybe Chloe, we might start with you.
Yep. Big question. I think there's a few things. I was really impressed by the previous panel and the way that the councils are working together. It's not just because I want to be part of the MacPac, but I kind of do. That level of coordination and really thoughtful planning and engagement is something that we're not yet doing in other spheres. So we could point to partnerships with industry, we can point to partnerships with universities, but I don't think, I mean, the missing chair here is actually someone from schools, so that from an education perspective, we're thinking about pathways for people who are leaving school, who are coming to TAFE, from TAFE to university, from university potentially back to TAFE. And so to leverage a kind of, a population where youth unemployment is 10 point something against a kind of statewide average of 8-ish, that we are not as integrated and connected as we can be. I think I would also say for an organisation like TAFE, we've been on recently a journey of trying to achieve better consistency. And so people in this room would say, we love TAFE, we want to work with TAFE, but you change the person we have to work with every 6 months. And so again, building those relationships in a way that are meaningful and long-term, I think is very important. On the skill recognition piece, that is a bit of a perennial problem, and I know there's a lot of work underway for that. I do think there's something in the national sphere about particularly recognition of overseas qualifications, but also how you do conversion in a way that is much less onerous. At the moment, the funding systems for that preference you just delivering the whole qualification again, because you'll get way more funding for the effort than you would if you just did a recognition of prior learning piece.
Systemic sort of barrier, right?
So there are some really obvious solutions to that have been raised and canvassed, and hopefully we'll see some movement on some of those in the near future.
So really interesting around how, you know, it isn't just about the partnerships and you know, the collaborations, but there's really a policy element that really facilitates or, you know, enables or disables these opportunities. So yeah, thanks for that, Chloe. Simone?
You know, I think there's a lot of challenges here. I think the kids need to see the potential, and they need, you know, Zoe talked before about the low rates of finishing year 12 and the low rates of access to university. It is really a struggle here to do that. So I think we have extraordinary challenges, really, with our population and our groups. And, you know, the Primary Health Network recently did a survey of GPs and what they struggle with. And they said travel times. And I was like, golly, you know, surely we can produce the GPs we need in southwestern Sydney and the Macarthur here for the future. So there is definitely an access issue in terms of those which we need to deal with. The other thing that I was thinking before is I completely agree that we need a Bunnings in Wollondilly. I think that's really important.
New t-shirts.
But you know what? I was recently in Darlinghurst, and someone from one of the big institutes there said to me, "Oh, Simone, you come from Southwest Sydney. You guys get all the money." And I looked around me, and I was like, "Oh yeah,
Yeah.
So I do think
world.
we need a Southwest Sydney economic strategy, right? I think we do partnership here in Southwestern Sydney extraordinarily well. And I think the MacPac is a great example of that. But we actually need to take it broader together. The jobs deficit is as significant here as housing and homes. As one of Billie's staff once told me, we've always had a homes issue, but the jobs is really significant. And to deal with that in the really important way we need to deal with it, we need an economic strategy for our region and just for our region. Because Southwest Sydney, with 1.2 billion people, deserves its own economic strategy and deserves that highlight of how we can have those really important smart jobs closer to home into the future.
Can I add a quick comment on that?
Sure, of
We did a
course.
TAFE Connect in Liverpool recently, and one of the top issues that they wanted the sort of population that we invited in to tell us how can TAFE be better, that they wanted us to solve was transport. And we kind of went, oh, well, that's not us, that's transport. And then we were like, no, they're talking to government when they're talking to you. They're looking for integrated solutions that are really different. So your GPs might have travel times that are prohibitive and they live in this area, let alone, you know, trying to come from outside the area in to deliver services. I do think there's something in an economic strategy, and I think there's something in a transport strategy, which Kate from Campbelltown was talking about also, is if there is public transport to get to TAFE, to get to jobs, to get to city centres, to get to the airport, that will do a whole bunch for how integrated this region can become.
And that's been an ongoing gap, Chloe. You know, I hear it all the time. I hear it now in health. I've heard it in other contexts in government, and it really is that siloed approach to planning and that sort of critical need for an integrated strategic approach that considers all these elements. But Zoe, staying on, how do we unlock the talent and the entrepreneurial spirit and enable and support that? Zoe, what are your thoughts on that?
Great, and perhaps I can give you an example to counter just some of the barriers we're talking about that's actually worked really well in Southwest. So we had this concept from community that they were especially keen to be bolted into an innovation ecosystem. We called it entrepreneurship, they called it change making. They wanted to change the future for their families, for their children and for their region. And we, in one of our precincts, it was Liverpool based on this occasion, working very closely with the Campbelltown Health and Education Precinct. We had more than 12 partner organisations that said, we're going to do something about this. We're going to run an entrepreneurship, or as the community would call it, change maker program. We did it in partnership across several universities, councils, moved activities around the Southwest, and I had some pretty ambitious targets for enrolment of that particular program, and it is well exceeded. We had an event only a week or so ago. We maxed out the Liverpool powerhouse. Those particular pitch nights have been won by Campbelltown each time. These are local people, and they range from, we've had 11-year-olds put up their hand in front of a university, top 20 worldwide university vice-chancellor, and say, but what about this? And I think that is community spirit at its best. And I think the bit you said about equity is really important. So, and I love this in a development forum that we have a panel that is all women. With our entrepreneurship programs in Southwest, when we started those, we had less than 2 or 3 women in a room of 20 or 30. And then you start asking, why is that the case? And you start to think about some of the barriers for why people might engage, not just with an entrepreneurship program, but also education. They've got caring responsibilities. They don't have transport that gets them to Westmead or to Randwick or to Tech Central in the city. they can't get to the activities that they'd like to participate in. So we took those barriers away. I handed out laptops. We drove people around with all kinds of transport to get them there. And our programs have consistently had over 60% female entrepreneurs that are all from Southwest Sydney participating in them. We heard 8 pitches the other night that were all solutions from local people for local problems. I had another 95 I couldn't put on stage. So huge community demand. And if you take those female entrepreneurs, if we were to get participation rates from those entrepreneurs in the workforce in the same way that we see in other areas of Sydney, we'd unlock another 83,000 female workers, and we drive something like 36 billion worth of gross value to the productivity of this state. And so I think there is such untapped potential. I understand we've got considerations around housing and affordability and all of those things, but there are some pretty fundamental things that when we work together, we unlocked. And Billie, I know you heard this example, but someone from a culturally and linguistically diverse background had pitched this idea. Did you know when you ring 000 that if you speak a different language, that they have to work through what kind of language you might have? And so it'll be, Zoe, so what language are you speaking? Because I need to try and engage an interpreter for you. And a local person said, why can't we have AI detect that language within the first 5 seconds of that call and patch it into a translator such that that language barrier doesn't result in a 20-minute potential delay to get access? And that's the kind of thing we saw play out over and over. Local people, local problems, local solutions and innovation backed by partnerships. And I think there's just so much potential to do that at scale.
Yeah, absolutely. And I think that's something we forget when we're in forums like this, in that our collaborations and our partnerships are really not grassroots. And I think councils get that because councils are working at the grassroots. But when you are working locally and facilitating those partnerships with local communities, and through those partnerships, you actually get to see those results that you don't get to see necessarily at the boardroom tables. So thank you for that. We're going to turn to some questions. There's one here for all of us, but there is one I'm going to bring to the fore, and thanks for that, whoever said, will a hospital be built in Oran Park in the future? So we've now got a bid for a hospital in Oran Park as well as a hospital in Wilton. Was that? Yep. So, health is acutely aware of the additional demands for health services in such a rapidly growing population. And Greg said earlier, we're not just growing into the future and growing currently, but we've been growing for 4 decades. So this is not a current problem. This is a problem that we're thinking about into the future, as well as how do we sort of catch up. Now, we are working on a range of different collaborations at the moment to explore expansion of services, specifically in that growth corridor. I think also in terms of the complexity of care, the government did invest specifically in additional capacity. And of course, as you all know, Campbelltown Hospital was just expanded and opened recently, but we've also just gone live with some additional capacity in our EDs through increasing safe staffing levels. So that's now live. And the integrated hubs is an absolute priority as well, and I look forward to sort of speaking to particularly local councils around that into the future. In terms of will there be a new hospital in Wilton and Oran Park? That is not in the pipeline in the next 12 months. So I just wanted to be really clear about that. But there's certainly Camden Hospital and Bowral Hospital as well that are looking, and Bowral Hospital's expansion was just completed and launched recently as well, really being cognizant of that sort of Wallandilly and Wingecarribee catchment area. The other question that I just wanted to bring to the panel is, how can Southwest Sydney's health and education precincts work together to not only... Oh, sorry, my mistake, rewind. The health and social workforce is statistically the largest in the region, and you already spoke to that, Simone. So how do we ensure that we create opportunities for people to work locally? So that being able to work locally, 66%, as Andrew said, of Camden leaves the LGA for work, and throughout their working lives. So it's not about going off to the city to work in your first 5 years, but also having those opportunities locally. And before, I'm going to ask Simone you to speak to that firstly, but before we go there, health is one of, if not the largest employer in southwestern Sydney, with almost 20,000 employees. Now, one of the things that really struck me when I'm in our different sites and facilities is that, and working with the frontline staff, is that we employ an extraordinary amount of people that live locally. We are and it's absolutely critical. I mean, yesterday I was in the maternity ward of Fairfield Hospital where I had my children, which was, it was lovely to be there again. And the midwife, the head midwife, had been there for 40 years and lives locally. And she said, why would I work anywhere else but Fairfield? This is my home. I work for my people, So there is, I think from a health perspective, absolutely that's happening. But how do we, Simone, your comments on that?
Well, when I recruit for a long time now, I'm obsessed where people live. Like, I'm so obsessed. Like, I'll always be like, and the last person I hired, she lived in Wilton, and she gets to now work in Campbelltown. And she has a 5-year-old and a 6-year-old, and it's a life-changing game changer for her because she used to work at Circular Quay. And so that's what I look at as success. And I think for me, the key to making this happen is allowing local people, is you've got to have careers here locally. We need the smart jobs, right? And the Justice Precinct in Campbelltown is vital. I'm a bit biased, but the growth of the Ingham Institute across southwestern Sydney is vital. The growth of advanced manufacturing is vital because you need to be able to progress your jobs as your career goes and have that journey. And I think that's why southwestern Sydney people are so special, and that's why it's my first question whenever I hire someone is where you're from, because they do want to work for their communities and they work harder for their communities because our communities are special with, 150 different nations and all of that. So for me, I think it is about, and that's why I talked about the economic strategy before, because it's about having those complex jobs closer to home. And I think health has done a great job. Those 20,000 jobs are the core of southwestern Sydney. 100%. But it can't just be health. It has to be other industries too. And those industries where we have that natural talent for. And I think, advanced manufacturing as an industry is a real area here that we can grow and develop, but we need support to do that.
Yeah. Chloe?
I think we need to show people the career pathways that exist in a region so they don't feel like they get to a certain point and they have to leave.
Yeah.
So for us, we're thinking about, particularly Southwest Sydney, we don't offer nursing. I have no idea why, but we don't. So we need to address that in the near future, and people need to be able to see that they don't have to go somewhere else to take a next step in their career, but also the suburban study hubs that Zoe mentioned let us do some more clever things about, if the course isn't offered right here, that you can study and remain in the local area. School education would be another one. We offer early childhood provision. We have school learning and support officers. They need another step to go to university to do education if they want to become a teacher. And so making sure that we're really integrated in that so that people get to stay and grow in their career is really important.
Yeah, thanks, Chloe. Zoe could...
And I think just quickly, we've got to leverage the partnerships when those local pathways don't deliver us something that we need for the ecosystem. And we've had some wonderful opportunities. So the Lang Walker building in Campbelltown has a particular focus around Indigenous health. So that's something where the workforce is scarce, that those skills need to be built up, and we need a really critical set of people that grow that for the response for that for the community. And in that case, we were able to, I'll speak about my own institution, but we were able to use UNSW to attract Australia's first Indigenous neurologist, who has started work down through Campbelltown Hospital and partnerships through the Ingham and other Southwest Sydney facilities. And so I think there's also that collaborative spirit in our health and education precincts to work together to bring the right talent in. The comment was made earlier, we're open for business. And I think there's also getting that right so that we get the right people in, because I want to see in 5 or 10 years' time, we've actually got a whole range of staff that are working against that priority to service our local community. And that's the part we can play in plugging those holes.
Great, thanks, Zoe. And of course, we could keep talking about this all afternoon, I'm sure. I know, but we have, I think, gone over time. My apologies. But please join me in thanking our panel.